Hello, my name is Catherine Hodge. I'm an In His Image graduate from 2013. My family moved to Nkhoma, Malawi in the year 2014, just after we graduated. We've been here at Nkhoma Mission Hospital for about 6 years now, and in the time of coronavirus, we've had to make some recent changes. So this is our hospital entrance. If you look this way, we had to make some changes to the entryway so that we could do some proper triage and screening. So we put some lines on the ground, and in the busy times of the day, which is 7 a.m. to 4 p.m., we actually triage about 1,200 people because that's when all of our sick patients will come in and all their family members. So the patients will wash their hands at the washing station here at the front, and then they'll stay a little bit distance on the lines while our team, wearing their full PPE, will then ask them about travel history, recent fever, cough, shortness of breath, and then from there, our clinician will do a respiratory triage system where we decide if a patient is a coronavirus suspect or can just go through our regular outpatient department. The coronavirus situation in Malawi is a little bit slow at the moment. We have 41 cases and 3 people have passed away. At the moment, the central hospitals belonging to the government are the only ones which are treating patients with coronavirus, but the government has just asked us to become the 5th testing site, which means that we will start to see a lot more of these patients as they're coming to be tested here. So once a patient is suspected to have coronavirus, we have to put them in this isolation room, and the test can take anywhere from 1 to 3 days. If and when we become a testing site, actually they bring us the specimen bottles and we test them here, that turnaround time will be much quicker. So at the moment, patients will come here into our isolation ward. This is the female one, the male one is directly next to it. We have about 6 to 8 beds in each room with some distancing. We'll keep the patients here as we care for them until we find out their coronavirus status. So all of this is very new and really coming out there into our districts, but not very well understood yet how exactly the community and the central hospitals at large are going to respond, because as you know, there's worldwide shortages of everything, including test kits. So our ability to test as a country has been very limited, as it has been many places. So we're preparing for many of these cases to come our way, but we're doing our best to keep coronavirus out of the hospital right now so that we can be taking care of our regular patients who still have all the same needs that they would on a normal day. And we're trying to keep our staff spiritually motivated and physically motivated by giving them the right protective equipment and by keeping the virus out of our hospital for as long as possible so we can continue to treat our other patients.